Hi, and welcome to Healthcare IT Today. I'm Colin Hung, and today I am joined by a team of people here at CAMH in Toronto. And we're going to talk about a wonderful piece of technology and process that they've put in place around including patient stories within their EHR. So I'm going to ask each of the people that are on the call with me to introduce themselves, and we'll start with Aileen. Over to you.
Hi, Aileen Sprott. I'm the risk specialist at CAMH.
Lydia?
Hi, I'm Lydia Sequeira. I'm a doctoral student at the Digital Mental Health Research Lab at CAMH and also doing a short fellowship at the Quality Safety Patient Team.
Amazing. Denise?
Hi, I'm Denise Johnson, social worker on the forensic general unit at CAMH.
Sarah?
Hi, I'm Sarah Kimball. I'm a member of the Patient Advisory Council. So I work with the team to bring the patient's voice.
And finally, Colin.
Hi, I'm Colin Chu, and I've been at the organization for a while and worn different hats. I'm currently a senior project manager working on forensic model of care, but my previous role was managing the clinical information system at CAMH.
Your name is going to be very hard to remember, just for the record. No. So I'm going to put this question to all of you, and then please take turns answering. But how did this start? So how did this project get started? How did it come about? What was the trigger to even think about including patient stories within your EHR?
I can field that question, and it's generally a little bit of a long answer because it's kind of a great story. But what happened was, as my previous role in being a manager of clinical information systems, various stakeholders come to you and they ask you, what can you do for us? And part of that work was, I think, Aileen's team was working on Safe and Well, a different, and she can kind of go off and tell you about that initiative. But they were wondering, how they could incorporate some of these interventions within an EHR. And one of the interventions was get to know you. We were just kind of bouncing off ideas, and then I went away. And then there was an opportunity that came up in our IMG department. And the IMG department was running an innovation expo. And I was thinking about, if you go back to one of my previous roles as a business analyst, I was interviewing on a different project, and it was called Patient Profile. How do we aggregate the things that you need to know about a patient in a short period of time? And I just recall a discussion that I had with our deputy chief of nursing at the time. And when you meet stakeholders, they say the same things, right? Oh, we need to get our medications in there. We need to get our legal status in there. We get to meet our lab values, our important documentation. It all needs to be there. Well, she came with a whole different lens to this. She's like, and this is back in 2008, right? So she's like, it would be great if you could tell who the patient story, who they are outside of the walls of the hospital. And so I at the time I was just kind of taking down requirements, and I just kind of walked away, right? I turned to my project manager. I'm like, that's not possible, right? That's not a thing, right? And then and I felt bad, right? Because you're like, and you think that you have to get everything that the person's asking, and you really feel bad. And I felt bad for many years passing her in the hallways. I just always felt that I let her down in some way. And so fast forward, and we have this opportunity of an innovation expo, right? So you got this opportunity to pitch something. And I was thinking, well, here we are now. At the time, we were a best in breed hospital. We had a different system for lab, different system for documenting, different system for medications, and we tried to clunk it together and make it all work. Then in 2014, we moved to a full CIS. So that was the idea. Well, now can we bring the mental health aspects to it, which we started to do. And then now, can we tell the patient's story? They were collecting so much data. Is there a way to tell the patient's story? And I think there is. So we pitched this idea to the Innovation Expo, and we didn't win, so that's not great. And I'm still pretty bitter about that. But at the same time, what it did was it gave us exposure throughout the organization. And there were people in the audience, there were people who wanted to put money behind it, right? To give us funding to go ahead and do such a project. So that gave us the ability to go out and work with Aileen as a project manager and kind of make our vision come to life, right? So, and Aileen, I don't know if you want to add anything about Safe and Well and any of that.
So any of that is sort of involves, and thank you, Colin, because you sort of triggered me to the fact that I did introduce myself as a risk specialist, which I am at the moment, but at the time of This Is Me, I was then a project manager, and very similar to Colin, other roles as well. But with the beauty of when Colin was working away at how to figure out how to give this, we were also, we meaning CAMH, was piloting safe wards. I don't know if people are familiar with that, but just very high level. It's evidence-based, randomly controlled model of care that has 10 different interventions, and one of the interventions is know each other. So from know each other, then we pulled out, and actually I was looking back at some notes. We originally were going to call it Know Me. And then we went to This Is Me. So there's a little bit of trivia for people who are not interested, but who are interested. So yeah, so we did Safe Wards, and which then came into another initiative, because it is, like Colin said earlier, it's not like, oh, we're going to do this and off we go. It's sort of the tree branch, you know. The seed was planted and we had different initiatives going on. So that's how This Is Me came to me. It was part of a task force of another initiative.
And why is it so important? Maybe we can hear from Sarah on this. Why is it so important to have this patient story captured in some form for the clinician? Why is it important to even have this?
I think it's important for two reasons. One, I want the nurses that I'm working with when I'm inpatient on a unit to view me as more than just depressed with PTSD. I want to be seen as more than my diagnosis. I want to be viewed as a whole person. And I have to say that my experience at CAMH, that's definitely been the case. They do try as much as possible to see you as a whole person. From a clinical perspective, how I've found it really helpful, and this isn't within This Is Me framework, but it's kind of using similar information in a similar way. My current psychiatrist uses the information that I've shared with him about my friends, my social supports, my hobbies, my interests, for him to kind of gauge how I'm doing on an ongoing basis. And when I do have a decline in my mental health, he uses it to assess my risk. Am I reaching out to my network? Am I continuing to do the hobbies I enjoy? And if he notices that I'm dropping any of them off, his antenna kind of go up and he starts thinking, okay, maybe we need to get a little more aggressive. Or if I am doing everything I'm supposed to be doing, he'll be like, okay, we can just manage this on an outpatient basis. So there's really the two facets.
Amazing. So the story does sound like it does help with the clinical side of things. It's not just a get to know me, but it's very helpful in maybe I won't say diagnosing, but indicating that there may be some other issues that they might want to talk to you about.
I think it can be.
Denise, anything to add there in terms of why, you know, this might be so important? And apologies, you're on mute.
There we go. I think just to echo what Sarah had just mentioned, like those are the key reasons, you know, we want, you know, to have this within our system. When we get to have an idea of the individuals that are coming to us, we get to know them a little bit better. They get to show us a part of them, so it's not just asking questions, and it's it's them showing us a part of themselves, which is quite nice. And then being able to turn around then also to work with them to see, those changes, or if there are any changes, to kind of help gauge to see how we can support individuals. So I think, I think it's working, and it sounds, it's working.
That's awesome. And maybe Lydia, a question for you. Can you maybe, for our audience, maybe describe how does the story actually get in there? Like, is this something that's done at the initial visit? Is this something that I fill out before I come for my visit? How does the patient story get captured in the EHR?
Yeah, that's a good question. I will give it a go, and then Colin or Aileen add to it. But how it works is currently at CAMH, there's a task that appears for social workers. The reason social workers was chosen is to kind of, be the first people to fill out this task, is because storytelling is such an important part of our job as a clinician. And so they go in, and there's a form that's actually connected to the landing page that has prompts to collaborate with the patient, ask them the question about who they are, what are some of the hobbies and things that they liked, what did they do for work before or while they're at the hospital, what is their family, where are their family pets, everything kind of about the patient is collected through these forms that are then connected to the landing page. And there's also parts of the landing page that come from a specific form in the electronic health record called the safety and comfort plan. So it's kind of pulling in pieces that either being documented as a result of this initiative, or pieces that are also documented through other assessments that are already done at the mission. I don't know if I missed anything, but feel free to.
Yeah, go ahead, Colin.
Yeah, so once again, we encourage like the social workers to start it, and then that ability on. So when you open a chart now on the inpatient side of the house, it's the first landing page, and there's a plus button on there. So if anybody gets another piece of information about the patient, they can go update that one section, as well as Lydia mentioned. The safety and comfort plan was something that the organization was making, that really put in a concerted effort that all our patients had a safety and comfort plan completed. But once it was completed, it was kind of hidden in the chart, right? It's hard to find, like, you have to be thinking about opening up this safety and comfort plan to review it. Well, you really need it if you don't know, when you're going out to see a patient, wouldn't it be nice to know exactly what those key questions are on the safety and comfort plan, and know how you might want to approach to kind of form that therapeutic relationship, right? So kind of putting it in people's faces, right?
And so just to elaborate on one thing that Lydia said, so this form that's filled out, is that something that the patient fills out, just to clarify, or is that something, so is that available on your website, or is that something that's filled out within your EHR that through the social worker, we fill it out together? Go ahead, Denise.
So that form is something that's filled out generally on with the social worker and the clients as they come onto the unit. So, in the first few days that they're on the unit, it's something that we can sit down and go over together. The clients have, it's put forward to them, and they have the choice of whether or not they'd like to be involved in this form. And if they are interested, then we'll sit down, we'll go through the various domains, and we can get to know them a little bit better. The beauty of this form, as well as it's on the home page, so it can follow them during different admissions, so they don't necessarily have to start from getting right from ground zero. I don't know what term to use, but right from the beginning, and kind of reintroducing themselves over and over again. It kind of gives us a nice starting point.
Cool. And maybe I'll ask Aileen this question. What's the reaction been to having these stories within the EHR? from a CAMH perspective, like from a staff perspective?
Do you know what? With the utmost respect, I'm going to ask Denise because
Okay.
she is the individual. If that's all right, Denise.
No, it's perfectly fine. Denise, what's the reaction been?
It's been a positive reaction from the staff members. They actually appreciated it when it first rolled out, and they continue to appreciate the fact that they get to know individuals, and maybe it's something that may not have come up in kind of an organic kind of conversation, or it may have, but it's just right there. They're able to open it up and see the individual in their words as, you know, a client coming in for service. So it's I think the staff definitely appreciate it. That's what I've heard.
And Sarah, what's the reaction been from a patient perspective with having your story being asked for and then being put into the EHR?
I can't actually really speak to that. I haven't been inpatient since this initiative was rolled out, so I've never actually completed one. I have completed a comfort and safety plan, and that's a very positive experience. And again, it's great to have it as part of the record because I was inpatient in CAMH prior to it being electronic, and my nurses and I were always fumbling around with little pieces of paper, you know, kind of going, well, we think it's here, we think it's there, which was less than optimal. But I imagine, just from my experience of using similar information with my psychiatrist, that I would find I would like staff members to have access to that information about me.
Excellent. And Colin, let me ask you then. Oh, sorry, Lydia, were you going to say something?
I was going to say, I can just add to that. So we did a small kind of evaluation after this was implemented, a year after. So I surveyed, you know, did like an in-person survey, sat down with about 26 patients and just heard what they had to say about it. And a lot of them actually remember completing the specific form, because there's obviously so many things that you're asked about when you're admitted. So when I kind of showed them the actual form and kind of gave them the prompts of what the questions may have been that they were asked, they were like, oh yeah, like some definitely remembered filling it out. Some of them maybe their clinician hadn't gotten to it just yet, but they all thought it was a great idea in terms of, there were comments about bringing everyone on the same page. And I think that's something that Sarah mentioned that some of the patients that we surveyed did echo. And then other kind of pieces where they wanted to almost have a copy of it beforehand. They thought it was reflexive to kind of go through and think about their story as well. So that's just some pieces from our evaluation that sure.
Yeah, and the reason why I asked this question is something that Sarah mentioned before. Is there, you know, on one hand, you can definitely see that having the story available and told will help humanize people, right? Like, you know, oh, you know my story a little bit, you know my personal situation. On the other hand, I'm assuming there might be some people who feel that's a lot of privacy I'm giving up, and what's that really for? But it sounds like in general, people don't mind, to want their nurses and their clinicians to know more about them as people rather than worry so much about, well, am I really telling my life story here to someone for no reason? Getting nods, but yeah, go ahead, Colin.
Yeah, I mean, so, and once again, you know, it's open for how much someone wants to share, right? And whether they want to participate or not participate as well. And so, you know, one of the, you know, and it's not a mental health or addictions type tool as well, because a great example will be after I gave that pitch at the Innovation Expo, I came home and then I had my parents over for dinner, and they were just like, you know, what are you been up to? And I was like, oh, I pitched this thing, right? And I told them what it was all about, you know, telling the patient's story. And my mom turned to me and she was really like upset, and she said, you know what? Your dad and I, and my parents, you know, they're both been in the nursing field for 30 years, 30 odd years each, right? And so they were really upset that the hospital that they had gone to get some care at that day for an appointment, You know, they said this would have made a world of difference in our experience just today. We walked into the office and we were faced with a physician who just said, "Do you speak English?" Right? And it was, and they were so upset that they weren't seen as, like, they didn't know them at all. Like, they made judgments on who they were, you know, and so it does change the trajectory of care. How you approach your patients, you should really know who your patients are.
You're on
Did you?
mute.
Yeah, I mean,
I'm sorry.
I was going to ask. So, did you have to modify anything in the EHR to accommodate these stories, or were you able to just use something right out of the box?
It was a lot of customization. We had some great developers. We still have some great developers. To my knowledge, you know, as much as I used to manage the system, I'm no like language expert, but from what my knowledge is that there are quite a few languages that were put together to make it work and make it look and make it seamless. You know, it's a really kind of a nod to the team that we had at CAMH on the technical side.
And what's, by the way, I should ask this question, given that we're a health IT company. Which EHR are you using?
It's Cerner.
Are you using Cerner? Okay, so you modified Cerner in order to accommodate these patient stories.
Yeah.
And Eileen, you were nodding your head violently there. Do you have something to add to that story about the customizations?
No, I'm nodding my head violently because I'm so passionate about this, because it's, I mean, it's patient is person, person is patient. It's like, it's the same thing. The individuals aren't in diagnosis or anything like that. So that's my enthusiastic head nodding. But in what Colin was saying, I mean, it was consultation after consultation after consultation as to what actually ended up on the page. I mean, it was fantastic. Everyone, once it started, people heard about it through the hospital. I mean, we had some great conversations with the gender identity clinic to make sure that individuals' pronouns were present, because there was no place on the EHR before that. So yeah, so it was pretty special.
So, and when you say consultation, did you meet with your with people like Denise, and did you meet with patients as well? Who was involved in those consultations?
Oh my goodness. So there were definitely social workers were there. We have advanced practice leads were there. We had the service user voice. Unfortunately, it wasn't Sarah at this time, but we had a few other individuals that had lived experience. We had the IMG folks at the table. We also, the way the governance structure worked, we also made sure that we had union conversations. So you name it, we made sure that anyone that might have something to say, that they were represented, because we wanted to make sure we didn't miss anything.
Sure. And how long did that whole thing take? Like, just in general, was this something that was like a couple of years, a couple months?
2 minutes.
2 minutes. Okay.
No, oh gosh, I guess all in all so the task force was in place for, I think it was about 6 months, give or take, but there was a lot of pre-work. And then right now we're still doing refinements on it, because, you know, continuous improvement, that's what we strive for. We just don't do it. We always try to make it better.
And so is it fully rolled out at CAMH to everyone? And this is a question to anybody. Has it been fully rolled out at CAMH, or have you still rolling it out in stages?
Well, it's rolled out for the inpatient population. That's not to say that, and when I say the inpatient population, I mean that a social worker on the inpatient side will get this kind of task to go do this form. The landing page, if you're an inpatient, would be this is me page. Now on the outpatient side of the house, there's nothing to stop you from filling out one of these and going to the This Is Me tab. Or if they had the patient was previously inpatient, and you went to the This Is Me tab, you would see all that information if it had been done, right? So it's just a little bit, in general, at our hospital, it's easier to control the workflow of the inpatients right now. whereas the outpatients workflow, it was not in scope of the project. But, it's something that we hope, as more patients, kind of the volume goes up, more patients, people will go and update those as they become outpatients.
And so, this sounds like Colin, from your story, this was a journey from 2008 until now, but it sounds like the implementation actually wasn't that long, 6 months to do all of the consultations and then pre-work and post-work. Like, I would say it sounds like more like a year, but you got this into the system and rolled it out completely to your organization, which is quite quick.
I was going to say, to your point, I mean, I think I presented that innovation forum in December, and Aileen, I think we were live in January, were we not? Or
October 30th, 2018.
There you go, right? So
seared in my brain.
Yeah, so I mean, that's less, it's 10 months from, pitching something to actually getting everybody around it and getting all the feedback and getting all the technical innovation to getting it in, right? So that's not bad.
And I think it's important to note, though, This Is Me was part of a larger initiative. So it had a lot of resources connected. So if we were doing, the consultation or decision was made, the governance structure was such that all the people we needed to speak with, there was a set, schedule for all that to happen, if that makes sense.
No, it does. Thank you for clarifying that. So this was one part of a larger initiative as opposed to a sole initiative on its own. And so that certainly seems to have helped, at least in terms of getting the project off the ground and pushed through.
Absolutely.
So let me ask this question of all of you, and we'll just go around the horn, and maybe we'll start with you, Denise. What lessons did you learn along the way as you rolled this out, as you were designing this? And by lessons learned, I mean, what would you do anything differently? Did you discover something as you were going through this process? Oh, you're muted, Denise.
As I had the opportunity to use the tool with the clients on an inpatient unit, I guess the experience I was able to have was just to be able to know who I'm working with. So I think that was like, being able to bring individuals in as a person into their care. I think that was not so much a learning, but just something to kind of keep in the forefront of your mind to say, this is an individual that I'm working with. They come with their own information and tools and strategies that work for them. So it's just more of a reminder as I was able to use this tool with individuals.
All right. Colin, over to you. What sort of lessons learned and things, if you look back on that project now, what would you maybe do differently or?
Well, I think the importance of having having buy-in to an initiative really, it helps move something along, right? If everybody kind of believes in the project, believes its importance. I've been on other projects where it's not evident to how this is helping people. This is a very clear line on how, and so everybody gets behind it because they really believe in it. And so I think that really helped move things along. In regards to, we're always looking at increased adoption and looking at adoption rates, and I think auditing is something that's very important that we we need to be creating more reports on how and monitoring these. And it's not just This Is Me, it's other types of documentation in general, just ensuring that those things are being done at every step along the way.
Aileen? Lessons learned. Anything that you kind of learned along the way that you thought, wow, this is pretty interesting, or that was maybe a revelation for you?
Yeah, well, I guess the big thing is the sustainability. And it's great to roll something out, but it's more important to say, okay, how are we going to sustain this? Making sure that all those structures are in place and also have a way to bring value add if need be. Like even now we have another working group that's looking at This Is Me to further improve it. So I think that was important. And yeah, just looking at other ways to communicate the existence of This Is Me, because there's still some staff, even though they're very supportive, it's like, well, I don't have time for it. Well, actually, you do, you know, because 75% of it is already pulled into it. You just have to do what you normally do, is have a chat with the people you're serving.
Excellent. That's a great lesson, actually. And Lydia, what about you? Is there anything that you're, as you were getting ready to present this and the solution itself, is there anything that you've learned or?
Yeah, I think similar to what Eileen said, I think building awareness across the organization and beyond is so important. That's something that I heard constantly come up when I was kind of trying to get feedback on it. It was hard to kind of know what they were talking about. And then once you told them about it, you know, they were like, oh yes, of course, that initiative. So just building awareness. And I think constantly, I might have like a slight research bias, but constantly asking the end users of it, whether that's the patients or the clinicians that are using it, on how we can improve it, and you know, taking into consideration all of those ideas.
Excellent. And Sarah, I'm going to ask you a slightly different question because I know you weren't involved with this project, but very important. What message would you give to any other organization listening to this or watching this who is thinking about involving patients, either in the design of something internally or involving patients in getting their story into the EHR? What would you say to an organization out there that's listening?
I would say it's incredibly important. I've been a patient at CAMH for more years than I care to admit. And I've kind of seen CAMH evolve as an organization from kind of a traditional medical model to being more patient-centered care. And it makes a huge difference to both the inpatient and outpatient experience in terms of comfort with the care received, and the quality of the care received. I've always been blown away by how open and receptive the nurses are on the inpatient units that I've been on to talking with me and getting to know me beyond my diagnosis, even before This Is Me was initiated. So I think culturally, it's something that really is kind of makes CAMH special. And it definitely has, you know, improved my relationships with the staff members I've worked with over the years.
Wonderful. I think that's because you know we talk about it a lot. I talk about it a lot that, you know, involving patients is always a good thing, and it's fantastic that CAMH has involved patients not only in the design of this, but also involved patients in giving their story and adding that element to the what would be a very, very clinical EHR. So thank you to all of you for spending time with me today to tell me your story of the patient's story. It's wonderful to see that you've actually accomplished this, and tip of the hat to all of you for getting this done here at CAMH.
Thank you, Colin.
Thanks for having us.
This has been Colin Hung at Healthcare IT Today. Thanks for listening.